Hey guys, I'm Melissa here. So, right now for my treatment with gastroparesis, my doctor is treating me through my Hickman catheter and through my feeding tube. So, I just wanted to kind of go through my process and, let you guys know what I do. So, it's very important not to cross-contaminate your feeding tube, which is non-sterile area, and your catheter, which must be a sterile area. So, what I do is I always keep my feeding tube set up just like this here. But I do my catheter first because I know that that way it limits the any bacteria maybe I didn't get off when I washed my hands or something. It just makes me feel better to do it after I do anything with my catheter. So what I'm going to do first is I'm just going to clean my area. My husband and I have like a double sink vanity, and so I covered it up with some nice new clean boards, and now I'm wiping them down with alcohol. So half of this area is for my feeding tube, and half of it is for my catheter. It's kind of time consuming, and that's the one thing. Well, not the one thing, but something I really don't like about the catheter is, the feeding tube is that it's like so time consuming. You have to crush your pills and put them in the water and then do all that. So, anyway, okay, so now I just washed my hands and used some hand sanitizer. We are going to set up the catheter, the sterile area first. So, sterile drape. You only want to touch the blue part. You don't want to expose the white part to your hands without gloves on. Not necessarily sterile gloves, but okay. So now I have my nice clean area. Now what I'm going to do is take out my flushes and my syringe. So right here I have two 10 ml saline flushes. I have one 5 ml heparin flush. And then I have one, it's like a 10 cc syringe for the Zofran that I take. The other medication that I take is promethazine. Promethazine has a black box warning. It's not a great medication, but it's the only thing that works for me. And I'm on the highest dose, which is 50 milligrams every 8 hours. So I've got these set up here. Kind of maybe see them right here, but now I'm going to get out the Zofran, just kind of set it on here. This is my my little vial of the promethazine. So now I have an area here. So what I'm going to do is, you don't want to reach across your sterile area, but I'm going around it, okay? So now I'm just going to grab some gloves, and then I will start getting ready for my infusion. One thing that's really been helpful is requesting swab caps from your pharmacy, because they're so much easier than alcohol. They clean better. They look like this, if you can see that. And what they do is very convenient. I have one on. I keep one on my catheter, when I'm not using it. Here's the one I'm going to put right back on there. Leave that on for 30 seconds. Okay? So, now what I'm going to do is I'm going to prepare my Zofran, because I have to take it out with the needle here. So, I got my Zofran. It's a new vial, so you don't really have to swab it with alcohol, but I've been in the hospital for an infection before with my PICC line that I had, and it was not a good experience, so I'm kind of really cautious about these types of things here. So I just clean that here. So I've got my Zofran. This is my 10 cc syringe, okay? Pull some air out of it. So I have 8 milligrams, which is 4 mLs. That's what my dose is. So I got 4 mLs right there. Now you don't want to recap your syringe, okay? So as soon as you're done, take that needle off, okay? Grab your saline flush. This is clean now. The swab cap's been on it for 30 seconds or more. So what you want to do is inject 5 ml of the saline flush, okay? 5. Okay, now I'm going to put in my Zofran, okay? Zofran gives me migraines, but it does help, so you gotta do what you gotta do, right? Alright, so what I'm going to do now is keep this saline flush on there to keep that area clean. I need to get a filter needle here. This is for the promethazine because it's in a glass kind of vial. So I have to switch needles here. So what I'm going to do is I take my saline that has 5 ml, put my needle on the end, and I connect the new 10 ml saline flush. Okay? Okay, now all you gotta do with these is just kind of pop the top off. Just like that. The glass, be careful, I've gotten cut so many times. So then you just draw out the medication. Now it's in there. Again, you don't want to recap it. So you're going to use it right away. So take off the 10 ml flush without using it. Connect the promethazine. And you should infuse it over about 5 minutes, especially at the beginning when you start taking it. I've been on it for so long. It doesn't really affect me. So, alright, so now I hooked up my other 10cc syringe. What I'm going to do is I'm going to pump it 3, 6, and 10 mLs. Okay? Got my heparin. I'm going to connect the heparin. I just use the heparin once a day at night. And I put that in with 2 pumps. Okay? Now the feeding tube's done. Alright? So, now I'm going to change my gloves and start on the feeding tube process. Now, here's the stuff for the feeding tube right here. What I've already done is I've already put some warm water in this cup. I crushed my pills in this blue thing here. Pill crusher that sucks, but that's all I got. So, what I'm going to do is put the medication right in here. Add whatever liquid medications that you have. This is magnesium citrate or whatever that seems to work really good for GP to kind of keep things moving. So I'm going to do 2 tablespoons of that. Feel like Julia Child. So then I kind of stir it with the syringe here, make sure that everything is dissolved, okay? Now I have a Mickey. So a Mickey is different because it's a detachable feeding tube, which I like much better. I just got it a couple weeks ago, and the same day I got a nerve block in my intestines through an endoscopy. And actually it did help with the pain some, but pain just comes with this territory, I guess. So I have my medication here. I'm just going to set it there for a second so that I can fill this back up with some water for after. Alrighty. Now, this is my Mickey. What you do is you just open it like that. You can use a small tube like this one, or you can use a bigger tube like this one. Just depends on what you're doing. You know, you'll find what's comfortable for you. So with the Mickey, I just kind of push it on there and then turn it. Now it's time to glove up, okay? Anytime that you are doing something like this, you want to glove up all the time. The most time-consuming part is crushing the pills, for me at least. So, here we go. I'm going to hook up the syringe to the end of this, which is attached to my Mickey. Okay? So, just want to inject it slowly. Okay, make sure you lock your tubing before you take it out. And this is just water, cold water. And I'm just going to fill my syringe with that and wash down the rest of the medications.